THC isn't all bad or all good. There are upsides, but there are risks too. It's about how you use it. Welcome to part 2B of my cannabis series. Today we'll cover what THC is, when it helps, and the safety rules that matter. Simple and practical. I have a disclaimer here. Again, I'm a family physician. I'm not a cannabis expert. You may ask, why do you talk if you are not expert? That's because more than 95% of patients who are referred to me for their mental health and ADHD treatment self-medicate with cannabis, and it affects their treatment and their wellness. Here I'm sharing my clinical experience and current research I've reviewed. Other practitioners may have different experience, different opinions. Here my goal is education and increasing awareness the best I can. And again, it's not medical advice. I'll walk through the evidence for THC's medical benefits, the key risks, safer use, and harm reduction tips if someone decides to use it. References are listed at the end. Let's zoom in on the molecule for a minute. Remember in part 1, I compared THC with our own natural cannabinoid system. Very interesting. We have CB1 receptors, imagine like message inboxes on our brain cells. They are more in memory areas, the prefrontal cortex for attention and judgment, the basal ganglia and cerebellum for coordination and reaction time, and dopamine reward pathways. Your body's own cannabinoids send quick, short texts to those inboxes to fine-tune memory, attention, movement, mood, and reward, and then they are disappearing. THC acts like a spammer, blasting thousands of loud messages, flooding many inboxes at once, which stay there way longer. That's why when you are high, those signals shift, and so do how you think, how you move, how you feel. There are also CB2 receptors in the body and immune system, which THC affects less strongly. The original cannabis plant used to be 2% THC. Today's flower and concentrates can be up to 10 times stronger. Flowers 15-20%, vapes and concentrates can reach 60 to 90% THC. Edibles are processed by liver into 11-OH THC, which can feel stronger and last longer. Talking about onset and duration. When inhaling, effects start quicker, in 2 to 10 minutes, and last shorter, 2 to 4 hours. When ingested, effects start half to 2 hours later and last 6 to more than 12 hours. This delay causes many accidental overdoses because people don't feel any quick effects, so they take more, which doubles the impact later. Tinctures and sprays sit somewhere between inhaled and edibles, slower than smoking, faster than gummies. Effects rise over 30 to 60 minutes. THC can help in some medical situations, and with more research we may find even more benefits. However, we need to know that risks climb in certain situations. I will talk about it today. We talked about THC and different types of products. Now let's talk about THC benefits. THC does have medical uses, mainly when standard treatments don't work or aren't tolerated. Evidence-based benefits are 1. Chemotherapy-related nausea and vomiting. There are prescription THC-like drugs, such as Nabilon, can help when anti-nausea medications aren't enough. Common side effects, dizziness and sleepiness. Another benefit is seen in severe appetite and weight loss, in conditions like AIDS-related anorexia or cancer cachexia. THC can boost appetite and make food more enjoyable. But please don't use THC if you are healthy and would like to gain weight. Another proved benefit is for multiple sclerosis spasms, small to moderate improvements in stiffness and sleep. In some places, including Canada, A THC CBD mouth spray, Sativex, is used when other treatments aren't effective. Pain relief in selected patients is another benefit. THC-containing products may offer modest relief for neuropathic pain, nerve pain, and improve sleep, usually as an add-on to other strategies. I read an article very recently about a phase 3 randomized controlled trial showing a not significant but positive effect on low back pain. When THC helps, it's usually modest and symptom targeted, and side effects such as slowed thinking, dizziness, anxiety, and tolerance with frequent use limit dosing. So we need to set our expectations. The goal is targeted symptom relief at the lowest effective dose. It's not getting high. Think of it as an add-on for tough symptoms, not first choice. We talked about benefits. Now let's talk about clear evidence about risks. There are same-day short-term effects and there are long-term effects. What can happen the day you use? It's harder to focus, remember things, and make good decisions. THC may help you fall asleep faster, but it can affect the quality of your sleep by cutting down your dream or REM sleep, rapid eye movement sleep. It's when you have dreams and the brain processes emotions, memories, and stress. With less REM, the next day you may feel more irritable, less flexible and creative, and your memory can be a bit poorer. These effects depend on dose and frequency. After frequent use, stopping often triggers REM rebound with vivid dreams for a week or two. The slower reaction time affects driving and any task that needs quick responses. You can still be impaired after the high fades, especially with edibles. That's why driving guidance is measured in hours, not feelings. Plan at least 6 hours after smoking or vaping and 12 to 24 hours after edibles before driving or safety-sensitive work, and even longer if the dose was high or you mix it with alcohol or other sedatives. Alcohol and THC amplify each other and increase risks. Some people feel very anxious or paranoid. Psychosis-like reactions, brief paranoia, illusions, losing touch with reality are more likely with high THC or big doses. If you feel too high, go to a quiet, safe place, hydrate yourself, don't drive or make big decisions. It's better if you use THC CBD balanced products. Why? Products with more CBD may mitigate and reduce anxiety or psychosis-like reactions for some people. They don't remove risk, especially at high THC doses. Why potency matters? Stronger products mean more THC reaches the brain for longer, raising the chances of impairment, scary reactions, and dependence. So, what are the long-term effects? As I mentioned in part 1, heavy, prolonged THC use can actually change how the brain is wired. Research in both animals and humans shows physical changes in brain cells and in the connections between brain regions. Attention, memory, processing speed can decline over time. Learning circuits get miswired, reinforcing drug-related habits instead of healthy ones. School, work, and social life can be affected. The earlier someone starts and the heavier the use, the greater the risk of long-lasting effects. Heavy THC use has been linked to lower sperm quality and possible ovulation disruption. About 0.5% of people who use cannabis experience cannabis-induced psychosis. Over half recover within 24 hours, but if symptoms last more than a week or there's prior psychosis, hospitalization would be common, about 54 to 76%. Large studies show regular cannabis use, especially daily high potency, is linked to a 2 to 5 times higher risk of schizophrenia spectrum illness. There are some other health risks too, like interactions with other medications. We see this both with THC and CBD. Example, warfarin, a blood thinner, stays in your body for longer duration. Also, some seizure, antidepressant, anti-anxiety, or heart-related medications. You need to check with your clinician or pharmacist. Another risk is with heart and circulation. THC raises heart rate and can stress the cardiovascular system. People with heart disease should be extra cautious. Smoking or vaping can worsen asthma or COPD and irritate the airways. Impaired depth perception and balance raise fall risk, especially in older adults and when combined with alcohol or other sedatives. There's a condition we call cannabinoid hyperemesis syndrome. That's repeated bouts of severe vomiting that's seen in some long-term heavy users, typically relieved by hot showers, but it only truly stops when THC use stops. Last but not least is increasing tolerance. There's this misconception that cannabis is not addictive, but I do see patients who really struggle to quit. That's an indication for cannabis use disorder or addiction to cannabis. This is a real, recognized condition. Bottom line, a stronger THC doesn't just mean a stronger high, it also means faster tolerance, higher risk of dependence, and a greater chance of addiction. Why do people turn to cannabis or other substances in the first place? Untreated mental health conditions like anxiety, trauma, or neurodevelopmental conditions that can affect mental health, like ADHD and autism spectrum, play a major role in self-medicating with substances like nicotine, alcohol, or cannabis. Cannabis use to cope with stress, insomnia, or pain is very common. Use often begins with curiosity and peer influence. Easy access doesn't help, of course. Family patterns, parental use often due to their own untreated conditions, and genetics can further increase vulnerability. There are short-term gains with long-term costs perceived benefits, like better focus, social ease, creativity, appetite or weight control, and performance. Marketing and cultural norms also shape beliefs, and once use is established, there's potential for reinforcement cycle to kick in. Tolerance builds and also avoiding withdrawals, so people end up using more. Who is at highest risk for dependence? Those who start young, teens or early 20s. I see adults with undiagnosed or untreated ADHD or anxiety in their 40s or older who began using cannabis as early as 12 or 13 and have been using since. Many have become highly dependent and find it hard to imagine life without it. 2. Daily or near daily use, mostly to cope with sleep, stress, or low mood. Using high-potency THC, vapes, dabs, or concentrates. Personal or family history of psychosis, bipolar disorder, anxiety, or depression. How common is cannabis use disorder? I give you some simple numbers. About 1 in 10 people who ever use cannabis will develop cannabis use disorder at some point. If use begins in adolescence, risk is about 1 in 6. In daily users, risk can be up to about 1 in 3. References for these numbers are at the end. What are the signs to watch for? Using more or longer than planned. Trying to cut down but no success. Cravings or needing more to get the same effect. Cannabis getting in the way of school, work, or relationships. Continuing despite problems like anxiety, low mood, memory, or motivation. Withdrawal when stopping. Signs of withdrawals are irritability, poor sleep, anxiety, low appetite, and low mood. This often starts in 1 to 3 days, peaks by a week, and can last 1 to 3 weeks. If you stop after heavy use, you may have a temporary uncomfortable come down. Sleep and mood are often the last to normalize. Let me share two scenarios with you. Sam, 19 years old, a very smart boy, was diagnosed with ADHD at age 6. Parents didn't want to label their child and didn't want their child to be on medications, so he was never treated. In grade 7, his friend was using weed after school. Access was easy, and he thought it's legal, so it should be safe and not addictive. So he started using too. In high school, he was using weed daily to focus and cope with stress and feel calmer. By first year university, he needed more to get the same effect. Mornings were foggy, sleep was off, could not sit in lectures and listen, so he dropped out. He got depressed and started using cocaine. At some point, he sought help and started proper ADHD treatment. He was able to taper high THC vapes. So clarity improved, anxiety gone, and he found the motivation to go back to school again. He started exercising and was very happy with his healthier lifestyle. Message here is the earlier you treat your ADHD or any other underlying mental health condition, the better you can prevent further substance use. David, 63 years old, with ongoing back pain. Smoking weed was helping him feel less pain. With increasing pain, he switched from flower to high THC vape. Small puffs turned into frequent hits. Tolerance increased. Most importantly, relief from vaping masked a red flag, pain, later found to have cancer, bone metastasis. My message here, don't let cannabis or any other painkillers delay a proper workup if you have new or worsening symptoms. So the question is when to seek urgent help. When you have paranoia, hallucinations, severe vomiting, chest pain, fainting, or suicidal thoughts, then seek medical care immediately. Is there a treatment for cannabis use disorder? There are no FDA-approved medications specifically for cannabis use disorder yet. In my experience, most people can successfully taper and cut out when they treat their underlying condition properly. By properly, I mean treatment with right medication, right dose, and right duration for the treatment. They find they don't need to self-medicate anymore. For those who have more difficulty, cognitive behavioral therapy, peer support, smart recovery, 12-step, or group programs are quite helpful. Temporary withdrawal symptoms can be helped by medications like sleep, anxiety, or nausea. Heavy daily users often need 2 to 4 weeks for brain receptors to reset. Who needs to avoid cannabis entirely? Number 1, pregnancy and breastfeeding. It's linked to lower birth weight and possible neurodevelopmental effects. THC passes into milk and accumulates. Best to avoid. Number 2, people with personal or family history of psychosis or bipolar disorder. With bipolar disorder, THC can precipitate mania or mixed states. Strongly consider avoiding. Number 3, children and teens. They are most vulnerable. Regular high THC use during brain development is associated with poorer attention, memory, and learning, and raises the risk of addiction and psychosis later. Best to avoid until age 26. Number 4 to avoid is unstable, heart disease, or higher risks for stroke. THC raises heart rate and blood pressure variability. Avoid if not well controlled. So we talked about who needs to avoid entirely, who needs to be more cautious. Number 1, older adults. They have higher risk of falls, confusion, and since they can be on multiple medications, there is more risk for drug interactions. So start low and go slow. Avoid high-dose edibles because effects are long and unpredictable, or use under medical experts' care. Number two, together with sedating medications or alcohol. THC adds sedation to other sedating medications like benzos, opioids, some antihistamines, and also alcohol. It means higher risk of accidents. THC can be detectable for days to weeks. Remember, after highs fade, impairment persists, especially with edibles. Heavy cannabis users tend to feel less positive and motivated, and more stressed and irritable than people who don't use. So, what about people with ADHD? Small studies and real world experience suggest THC and stimulants pull in opposite directions. People with ADHD often have lower baseline dopamine, so THC can feel extra rewarding at first. But over time, it impairs attention, working memory, processing speed, motivation is the big one, and emotional regulation. And this is exactly the opposite of treatment with ADHD medications. Mixing them cuts benefits and magnify risks. Many people feel medicated but still foggy. Using both together may have a synergistic effect in increasing heart rate, blood pressure, chest discomfort. Many adults with ADHD have at least one co-occurring mental health problem, and THC increases the risk of anxiety, panics, and mood swings. This is why most clinicians, including myself, advise avoiding or minimizing THC while optimizing ADHD treatment. I will talk about ADHD and cannabis in more detail in my next videos. If you choose to use THC, I have a few quick tips that can lower your risks. Know your reasons for using. Are there healthier, safer ways to treat your symptoms? Know your goal. Use it for a specific symptom. If there's no clear benefit, reconsider using. Start low and go slow. Track triggers like stress or insomnia and use non-cannabis tools, sleep routine, sleep hygiene, exercise, therapies, and medications when appropriate. Avoid high potency concentrates and dabs. Prefer THC CBD 1:1 or higher CBD when possible. Potency labels aren't perfect. Look for regulated, tested products. Limit frequency. Avoid daily use. Schedule non-use days or periodic tolerance breaks. Don't mix with sedatives or alcohol. Follow the driving and safety guidance. Smoking and vaping irritates lungs. If using, keep temperatures low and doses small. Avoid illicit or unknown vape liquids. Stick to regulated products and lower temperatures. If you inhale, stick to less than 2 small puffs, about 1 to 2 milligram THC. Wait 10 to 15 minutes before more. For edibles, stick to 2.55 milligram THC. Wait at least 2 hours before taking more. And again, use labeled milligrams and go slower. I can't emphasize more. Store safely. Pediatric poisoning rose after edibles became common. Treat edibles like medications, locked in original packaging, away from snacks and candies. Quality isn't guaranteed. Retail labels can misstate THC, and some products may contain contaminants like pesticides or heavy metals. It's important to choose regulated products. So that's THC, a compound with some real medical uses, but also clear significant risks, especially in today's high potency market. So my take-home message here, find out why you are using, what does it do for you, address the underlying reason, and try to replace it with healthier choices. If you use it for specific evidence-based targets at the lowest effective dose, as an adjunct, and don't substitute it for care you actually need. I highly recommend watching part 1, How Cannabis Works. If you want to know about CBD and CBG, that's in part 2A. And before you try anything labeled herbal or legal, watch part 2C on synthetic cannabinoids. synthetics like K2 spice, what makes them unpredictable, and how to stay safe. If you find it helpful, share the addiction and cannabis playlist with those who may benefit. Thank you for watching.